A new study by Harvard researchers, published in the Journal of Epidemiology and Community Health, indicates that higher intakes of fruits and vegetables are associated with lower mortality and better overall health outcomes. The study followed over 120,000 men and women from 30 years to 82 years old. Over the course of 8 years, people who ate at least 3 servings of fruits or vegetables every day had lower mortality rates than those who ate less than 1 serving every other day, even after adjusting for lifestyle factors such as body mass index, BMI, physical activity level, smoking habits, and alcohol consumption. The report researchers at the Center for Hospitality and Culinary Arts at George Brown College, Observational Study, Nurses Health Study, UC Irvine School of Medicine and Schools of Public Health, organization, found that a higher intake of fruits was associated with lower mortality rates in men. In addition to eating more fruits and vegetables in general, they also found that eating a healthier oil like olive oil on your food when cooking was associated with lower risk factors related to cardiovascular disease. The report was published in Healthcare Science, Field of Study. The science behind it: we've been told for years that a diet rich in fruits and vegetables is good for our health. A new study seems to confirm those rumors. The scientists looked at data from nurses who were part of 2 long-term studies, one starting in 1976 and another in 1980. Their findings showed that those who ate 5 servings, 1 cup, or more per day of fruits and vegetables had a 10% lower mortality rate than those who consumed just 3 servings, 1 cup, or less per day. The benefits: the lore of running suggests that runners live longer, healthier lives. Now there's data to support that claim. In an analysis released yesterday by researchers at Harvard University and published in JAMA Internal Medicine, it was found that men who had run at least 20 miles per week were less likely to die during a given 7-year period than those who did not run. The study also examined whether cooking oils could negatively impact one's heart health. Myths debunked: several studies have been published on mortality and higher fruit and vegetable intake. One in particular, the Nurses Health Study, indicated that those who consumed more than 4 servings a day had significantly lower risk of heart disease and stroke. This meta-analysis by Dr. Hobbs indicates that many health groups encourage people to eat 5 or more servings a day. But Dr. Hobbs also points out there are conflicts of interest in how these results were reported and how organizations should be accountable for their reporting practices. Why fruits are important in your diet: health experts have long preached that we should aim to eat more fruits and vegetables. Now, a new study from researchers at Harvard Medical School and in Europe indicates that higher intakes of fruit and vegetables were associated with lower mortality. The healthiest oils to cook with, extra virgin olive oil, IVU, is also considered one of best oils for cooking. According to Dr. What makes you crave fruits? A study from Temerty Faculty of Medicine at McGill University indicates that higher intakes of fruit and vegetables were associated with lower mortality. In other words, if you really want to improve your chances at a long life, it is recommended that you eat more fruits and vegetables. However, why do some people crave fruits while others prefer veggies? Let's take a look at what makes us want to indulge in certain foods. How much is enough? The Harvard study examined roughly 38,000 women. The researchers divided them into 5 groups depending on how many servings of fruits and vegetables they consumed each day. When they followed up on their subjects over a period ranging from 10 to 26 years, 1985 to 2010, they found that women who ate more than 5 servings per day had a 14% lower risk of death during that time compared to those who ate fewer than 1 serving per day. Twitter, Pinterest, Quora, Type medium by